morning and welcome to High Voltage, coming to you exclusively on Volt 104.3 FM. Today is World Prematurity Day. It is the 17th of November, and we are celebrating the World Prematurity Day. And we will be talking to some persons to tell us what all these big words are going to be. And according to estimates, right, in 2024, around 15 million babies worldwide are expected to be born prematurely. But guess what? Over 3 million babies are going to be born prematurely in 2024 in Nigeria. That is a staggering number. And we're going to be talking about that with Dr. Chinelo Obiora Izuka, a consultant pediatrician and neonatologist at the newborn unit of the University of Nigeria Teaching Hospital. Welcome.
Thank you.
And we have Dr. Grace Agu, also a consultant pediatrician and neonatologist at the newborn unit of the University of Nigeria, Nsukka. Okay, um, let's talk. Okay, let's just talk this morning. Welcome.
Thank you and good morning.
Morning. Okay. So, according to the reports I have here, according to the estimates, in this 2024, about 15 million babies are going to be born prematurely, or most of them. This is already November, so most of that number have already been born prematurely. But the staggering thing is about 3 million babies are either already born or are going to be born, in Nigeria prematurely. Why is that so? It's a staggering number. Why is it so?
Okay. Thank you very much and good morning once again. Prematurity is a strong burden in Nigeria, and as you rightly say, 3 million babies will be born in 2024 in Nigeria alone. There are so many things and risks that can lead to prematurity. And maybe that's to answer your question, why is it so? There are problems with the mothers, problems with the babies, and all these things put together can lead to a woman delivering before her time. Let me start by defining prematurity.
Yes, please.
Prematurity is babies born before 37 weeks of age. That's the 10 babies are born within 37 and 40 weeks of gestation. But any baby born below 37 weeks is termed preterm babies. And this high rate is because there are conditions in the mother that can lead to babies coming before their time. Some of these conditions are chronic conditions like hypertension, like diabetes in the mother, like abnormal uterine factors, like short cervix.
We'll
and
get to that
others.
point. It's
Yeah.
it's quite like a whole
A
litany
whole
of
lot,
things that
a
are
whole lot
that
that
are
can lead
causing.
to prematurity. So, and the prevalence is increasing in this country each day because of the prevalence, because of the problems that is increasing in Nigeria and the tough environment.
Are
also.
you saying that the recent economic situation or the recent way Nigeria is turning out to be, is it part of what is causing the numbers to increase, or is it just something supernatural?
No, it's not supernatural. There are, yes, the conditions and the stress that the stress that mothers go through is increasing daily in this nation because of the current situation in this country. And it may be another factor why we have an increased prevalence in Nigeria.
Okay, so we have quite a lot of people. I've met a lot of people who were born prematurely, right? Um, does this being born prematurely, is it more when you're carrying multiples or when you're carrying singles, and why?
Thank you for the question.
Complete.
Yes, multiple multiple gestation is one of the risk factors. So having more babies inside the womb at the same time we predispose to preterm delivery.
Okay, so you're saying if you have more than one,
If you-
it's
Exactly, that's what I'm trying to say. If
okay.
you have more than one, the risk is higher.
Why? Why is this reason? I mean, it's the belly, it's the womb, and it's meant to carry babies. So,
Yeah, you talk about the very fine. You also consider the space in the nutritional factors, and a woman with multiple gestation is also predisposed to higher medical conditions
Okay.
that could also predispose to preterm delivery.
Okay.
Like a woman that has multiple gestation has a higher chance of coming down with hypertension, like preeclampsia, eclampsia, which is one of the prominent factor in preterm delivery. And that woman that has multiple babies in there also requires more advanced care. So it's time a higher risk pregnancy.
Okay, if you're just joining us, this is High Voltage coming to you exclusively on Volt 104.3 FM. And today, 17th November, is the World Premature Day. And we are discussing prematurity. And of course, the documents we have here say Nigeria will and is going to have about 3 million babies. 3 million. That is a staggering number. 3 million babies born, prematurely in Nigeria. But I also have, from the documents I have here, the neonatal mortality rate is about 41 out of every 1,000 deaths. That is, it means that 41 babies are not going to make it out of 1,000 babies born prematurely. Why is it so? Is it something about Nigeria? Is it something about our medical health? Or is it, well, that's how it is everywhere?
That's not how it is.
Okay.
Let's look at the premature babies. About 1 in every 10 of premature babies born in Nigeria will likely die. While they will likely survive.
Likely survive.
Yes, sorry.
Okay.
Then,
All right.
in other developed countries, we have like 9 out of the 10 of them born. And let me use extreme preterm babies. When I say extreme, I mean babies born below 28 weeks of gestation.
Okay, doctors, you say 28 weeks. For us, we say 1 month or 2 months. This 28 weeks, how do you tell it to the ordinary person on the street? Would you say it's 6 months? Would you call it 7 months or 5 months? What can you estimate it to be?
Okay, 28 weeks.
Okay, we need to do a small calculation right here. Okay.
7 months.
Okay.
About 7 months.
About 7 months?
Yes.
Okay. So you're saying babies born at 7 months is really, really premature?
Yes, they are really premature. Like if you classify prematurities, there are people that are mild preterm babies. There are people that are moderately preterm. There are people that are very preterm. Then there are babies that are extreme preterm. These are the ones I'm talking about now, that are below 28 weeks of gestation. And I mean, those people will die.
You need to speak up. So you need to come close to the mic and speak up.
What about?
Okay, those extreme preterm babies will likely have a higher chance of dying in this country. And you said, why is it so? And why is it better in outside this country than in Nigeria? It is so because the when a baby is born prematurely, there are things that are involved to keep that baby. The baby did not develop. Their organs have not developed in the womb. So these babies, when they come out, there are management plan to keep them and make sure that they will stay and allow those organs to develop before they are discharged. Then the equipment to keep those babies alive, equipment to keep them developing, we lack more than developed countries. Maybe that's why in Nigeria we have more mortality for preterm babies compared to outside this place.
Do you think that preterm babies from poor families tend to die, more than preterm babies from rich families? Do you think so, Doc?
Yes.
Why do you think so?
Economic poverty is one of the risk factors. Poor economic situation. Awareness, education, access to health care. They are all socio-economic factors that contribute majorly to preterm delivery. I want to talk a little about your 28 weeks because I saw this kind of a look on your face. It means 7 months can't survive.
Yes, I mean, we all look like, 7 months, I mean, baby is strong.
Cut-off age is actually used for Nigeria. Every country has defined what they call age of viability.
Okay.
That is to say, the age babies are expected to survive outside the womb.
Okay.
Countries like America, Canada,
Mm-hmm.
their own has come down to about 24 to
Mm.
25 weeks.
Wow.
Yes, as a matter of fact, the survival rate for those that are born 24, 25 weeks is what we are getting for babies born at 28 weeks.
Mm-hmm.
Like 30 to 50% survival. That is what we are still struggling at 28 weeks. Why is it so? A lot of things. Aisha said, medical care. It can never be overemphasized. Remember, one of the things said access to quality healthcare everywhere. So it's very, very important. Just like she said, in terms of structure, the environment, the care, the manpower, even the patients themselves, their awareness, access to care. So when you talk about poverty, poverty is in diverse form.
Mm-hmm.
It could be in terms of knowledge. One of the reasons why we are here today, educating people on prematurity and the challenges.
Yeah.
It may be that they don't have access to healthcare.
Mm-hmm.
Or even when they present, because we do more of out-of-pocket expenses in
Yeah.
this environment, we don't have good insurance.
Insurance companies, okay?
And we cannot take away the fact that timely intervention is a key. So at times they will even come, but you're handicapped, that you may not even do the things you know, even the ones you know you can do. As delay will cause a lot of harm. Again, for them to be transported from where they're coming from to get a good health center, it's good. Most of the delivery is still being conducted outside by birth attendants.
Are you telling me?
Yes.
In Nigeria today,
Nigeria.
birth attendants,
Yes.
like the local midwives,
Yes.
Still happens in
Majority of the
Nigeria.
delivery happen outside the hospital. And most time they deliver them and they bring them to us. So you can imagine the challenges, the rigors and everything. Now, we talk about nutrition, which also goes with poverty. We also know that poor nutrition can also predispose to prematurity. We now talk about the socio-economic factor, the cultural barriers. Will the woman be able to take the decision to go to the hospital without her husband's consent? All these are very
I just do not want to get into husband's consent. It's
or even extended family consent. You know there's a
it's
place that you can't even move until the king or the head of the not even husband now.
the king of the community would give you permission. Wow.
The mother-in-law, the father-in-law, but there will be a meeting first to even agree.
It happens in this town.
It's still happening.
Do you actually see it? Because I'm flabbergasted right now.
That the decision to bring this child to hospital must be taken by the eldest member of the family before the woman is allowed to carry this child in the hospital. Even when the woman manages to get to the hospital, they will come and say, we want this baby to go home with us now. Stop every treatment.
And it happens.
Oh my God.
Do you agree, knowing the challenges that child is going to face? Would you agree, knowing that child just may not make it if he leaves the hospital?
Yeah, that's what is called autonomy. Respect for autonomy.
Autonomy.
You have to uphold the parental autonomy. Though in some cases you may need to.
Are there times when you try to override that autonomy and insist that child is going to get the care that the child needs?
Yes, we have done that severally.
Okay.
But the truth is that we have to consider a lot of things. Remember, the system is still a major issue.
Yeah, I know.
Take that child. How far are he going to go? Who is going to provide?
And
Because
pay.
we pay out of pocket. The legal system, the ethical system. If the child eventually survives, who is going to provide home for the child? So, but in a place where things are done the way it should be, yes, you have the right, because that child is still a minor. So as a healthcare provider, you actually have the right to take away the rights of the parents, as long as what you're doing is like a benefit outweighing the risk.
The risk,
But
okay.
you have to have a support system.
A support system. Okay, if you're joining us, this is Comfort Zone. This is High Voltage coming to you exclusively on Volt 104.3 FM. My name is Malaika, and we are talking about the World Prematurity Day. Is the 17th of November, and I have with me very, very powerful women. Dr. Chinelo Obiora Izuka, who is a consultant pediatrician and neonatologist at the newborn unit of the University of Nigeria Teaching Hospital, Itukwazala. We also have Dr. Grace Ago, a consultant pediatrician also, and a neonatologist at the newborn unit of the UNTH. Just a little diverging right now. Neonatology, what exactly now it is? Are you different from just a pediatrician? There's a pediatrician, there's a neonatologist. Are both of you doing the same thing, or are you specializing on,
Like pediatricians are doctors that deal with children. But when you talk about neonatology, the doctor that take care of the neonate, and the neonate is defined as a child between the age of 0 to 26 days. 20 or 28 days of life.
Okay.
So the neonatology are just a specialist in newborn, babies born within the first 1 month of life.
Okay, so whether they are born at 9 months, or at 8 months, or at 7 months, or even at 6 months, the first 28 days you're trying to keep them alive. Okay, you can join this conversation by calling us on 0706 048 5853 or 0915 570 8347. Please, when you call us, turn down the volume on your radio set. Hello, good morning. Okay, do call back 0706 048 5853 if you know someone who has given birth to premature babies, who is struggling, who needs some medical advice, who needs to know how to go about it. Do call in. The number is 0706 048 5853. Don't forget, you can join us on YouTube at High Voltage Nigeria. High Voltage Nigeria is the handle, so you can join us on YouTube and be part of that conversation. Okay. Now, Doc, I'd like to ask you. Okay, what causes a woman to go into labor prematurely? Because at the point where you get pregnant, everything is fine. You're going to the market, you're going to school, you're fine, right? Then all of a sudden, something just goes wrong along the way, right? What exactly would cause a woman to want to pop out that child, before time?
Okay. The things that can cause preterm delivery are many, and one of them is some things that have to do with the mother.
Okay.
The first one is chronic illnesses in the mother. And this chronic illness can be as a form of, as she mentioned before, hypertension, which we call preeclampsia in the mother. And also diabetes. In a mother with diabetes, it can be a gestational diabetes. That is diabetes that started with the pregnancy, or the chronic, the one that has been ongoing before the pregnancy. That's the diabetic patient that got pregnant. Then diabetes can be a cause. Then, apart from that, other chronic infection like renal diseases, cardiac diseases in the mother, maybe a mother that has a cardiac condition, all these chronic illnesses can lead to the pregnancy ending before time. Apart from chronic illnesses, there are infections in the mother, like uterine infection, that's an infection in the womb. Okay. Then there are also cervical infection, any infection around, or even if severe systemic infection in the mother can lead the mother to bring out the babies before time. Apart from that, there are structural abnormalities. Maybe the womb is not structurally abnormal, it's not well positioned, it's not well formed like a normal womb of a woman. It can make that woman not to extend to 9 months, expanding to carry this baby. Then, apart from the uterus, which is a womb, you have the cervix. Cervix is the window to the womb, is the door. Let me call it the door, not the window. Okay. Where you talk about when it's dilating, that's when the baby comes out, when the baby comes out. So, if the cervix is short, or other abnormalities of the cervix, it can lead to preterm delivery. Then, when you have multiple gestation, like 1, 2, 3, 4, Sometimes in these days of IVF, you have 4 babies in the womb. The space may be too small for them
All
to
of them.
all grow to maturity. So by the time they grow to a certain age where the womb cannot expand again to contain them, the tendency is that the mothers may go into preterm delivery. These and many more can lead to
Recently
premature delivery.
we had a young girl who was 22 who got pregnant out of wedlock, got pregnant for her boyfriend. She's just 22 in school, and she was threatening to abort. Okay, and oh, she kept crying, oh, I can't, I'm in school, I'm in third year, I can't do this and all of that. So she calls into one of our shows, and then we talk to her, try to get her to say, oh no, you can't abort the baby, we are pro-life. And then she agrees to keep the baby, right? And then I think it was about 3 weeks later, she calls again, and then all hell was let loose. She was screaming, says, no, I've just gone to hospital, and it's not just one, it's two. I'm not doing this, right? And then we go through another rounds of trying to tell her, no, you can't abort. Please just keep the babies, right? Anyway, some time passes, the parents get involved and all of that. They decide they're going to marry the two young, the 22 and the 24-year-old. Then I think 2 or 3 months later, she calls and then she's flabbergasted. No, it's not two, it's four. They just found out it's four. It's four, and we thought she was joking and she kept, crying. Anyway, she just recently delivered and babies are fine. It was just like a seamless, So my question is, did she give birth to those babies? Hale, hearty, everything fine because she's younger? Or did her age help to make sure that she carried those babies, because there were no complaints, there were no issues, there were no stories. I think it was 3 girls and a boy. Okay. And did her age, being 22, still being young, did it affect the viability of the children? Did it affect the process of her giving birth to the children without any complications? Did it have anything to do with it?
Yes, thank you for the question. The truth is that age, at the time any lady has her first child, plays a very important role. So that age of 22 is a good time. It's not less than 18 and it's not more than 35 years. So at that time, the risk of other medical disorders that accompany
aging,
is minimal. All right. Now, some of the, I don't know what happened. It's obvious it was a natural conception.
Obviously, she got pregnant for her boyfriend in school.
So you see, okay, we also notice that women that conceive naturally, they have a minimal risk, compared to those that did artificial
insemination. Okay.
All right. So I feel that age must have played very important role. And constitutional. Some people, there are factors that are constitutional, genetic makeup. People can actually pull through some conditions better than others. All right. So that age played a role. Then again, I talk about maybe the medical care, the nutrition, and her pre-pregnancy states now.
Okay, tell me about that.
Like, if she was not diabetic, not hypertensive, which is most likely to be the norm among that age. So you see that her pre-pregnancy state would have helped. Also her weight, probably not obese, not man.
Does weight affect?
They all contribute in different ways. So we are not looking at just the age. Yes, age is very, very key. But I also think there are other prevailing factors that might have helped her to cope
with that. Okay. 0706-048-5853. You can either call in to ask questions, or you can send a text or a WhatsApp message to ask your questions. So Doc, I'd just like to ask you, what causes a woman who was perfectly fine to suddenly develop high blood pressure during pregnancy? Is it just the pregnancy decided to trigger some things in the body, because I've seen ladies who never had an issue, was perfectly fine, they never had a blood pressure issue until they got married. As a matter of fact, I had a woman who unfortunately didn't survive. She didn't survive, her baby didn't survive. She was at 39 weeks of pregnancy, got to the hospital, was about the time to give birth. I think her blood pressure was high. The doctors were supposed to try to bring it down before they carried out the procedure, on her. And somehow something went wrong in that hole, and she didn't make it. The baby didn't make it. What exactly causes high blood pressure during pregnancy, especially when the person did not have it before that pregnancy?
Okay, thank you. Pregnancy-induced hypertension, that's what we call it,
Okay.
or preeclampsia, is common, and it can occur in people not pre-pregnancy time without hypertension, and most of them has to do with the placenta. The placenta secretes some hormones, and these hormones are supposed to keep the baby alive and keep the baby, maintain the pregnancy till term. And these hormones in some people are adversely affect some people, leading to their blood pressure to go high. It doesn't happen to everybody, and it has nothing to do with age, although it's more common in elderly people than in younger people. But it can also occur in perfectly young woman that's just got pregnant without hypertension before, and it has to do with the placenta hormonal secretions.
So it's obvious that between 17 and 35, that's like a safe time for you to give birth to all of your children without all the many issues. And then after 35, you are in God's hands.
High risk.
It's a high risk.
So from 35 is a high risk
Yeah,
pregnancy.
And below 17 is also a high
high
risk
risk.
pregnancy.
Why is that below 17? Body hasn't developed?
Yes, there are tendency for the girl is not developed to carry pregnancy. No, the birth canal is also not developed to birth the baby.
At
So
17?
yes, that's why it's also a risk factor.
Okay, let's talk about steps to prevent this preterm. Are there some things that we can do, right, Doc, to prevent? Is it preventable, having a preterm baby? I mean, everyone who gets pregnant really wants to carry their babies to full term. But before I ask that question, I think I'm a culprit, right? I think I'm a very lazy mother, me. So for me, when I get to like 36 weeks, I'm tired. I am worn out. I want the babies out, So I had, I think it was my second baby. I got to 36 weeks and 5 days. And my doctor, Professor Chibu, he was going to travel abroad, and he was going to come back at 39 weeks. And I just could not imagine me carrying the babies to 39. So I opted to bring out the baby at 36 weeks, 5 days. Did I give birth to premature?
Yes.
You did.
But he came out at 3 kg,
Yeah.
3.2 kg. Came out really big, He came out really big. So at that point, was he a preterm baby?
Yeah.
Yes.
Any baby that has not completed 37 weeks is term preterm. So you delivered late preterm. And that is not supposed to be so.
1 minute to
It's not supposed to be so.
2 minutes.
The truth is that the longer they stay in there, the better for them. So as long as the mother is fine and the baby is fine, there is no massive rush bringing out that baby. Oh yes, I had the same experience, but my own, I was denied. They said my baby must remain there. I even passed 40 weeks.
Are you serious?
They said no way. That is not yet the time to induce the baby. That I'm fine and the baby is fine. That if I should do that, it means that I'm not helping the baby. Because the truth is that let's preterm baby still needs to struggle to cope with the environment. Honestly, that is the fact. It's just that they are likely to do better than the ones
The
that,
early preterm babies.
So back to our main question, prevention. The truth is that for us to look at the prevention, we also have to understand that the same way we have multiple factors contributing to preterm delivery. That is also the approach we look at
Okay.
prevention. Now, she talked about the causes. Also, there are factors that are modifiable and there are factors that are non-modifiable.
Okay.
For instance, one of the causes of this preterm could be familiar, because you've had it before or because there is a family history. You stand a higher chance of giving birth.
Genetics?
Yes.
Okay.
They also have some genetic factors, like in terms of cervical insufficiency. She talked about cervix. To some people, their own cause of preterm is because their cervix are short and insufficient.
What do you mean by insufficient?
They can't really hold on and carry the baby till term. Some of them, they do circulage for them.
Yeah, so doctors, you like to speak big,
Okay,
very big grammars, right? So we are talking to the woman on the street, right? So you're saying, okay, the cervix is short and it doesn't have the manpower to hold on to that baby.
Yeah.
Okay, so circulage means you go back to the hospital and they tie it.
Something.
Okay,
like,
to hold the baby from
it,
coming out. Okay.
The pressure and the force. That's one of the reasons why multiple gestation, they're also a factor, because with the pressure, the weight, it can actually start opening prior to the time.
I see.
Okay, now, so when we talk about prevention, we have to consider the factors, the ones that are modifiable, like lifestyle. Okay.
Yes. Talk about lifestyle. What exactly in lifestyle? Drinking?
Okay. I'll come.
Tell me.
All right. So let's do the prevention from there.
Okay, so let's just take this call first. Okay, 0706-048-5853. When you call, please turn down the volume on your radio. So you can either call 0706-048-5853. If you're just joining us, we are talking about the World Prematurity Day. A lot of babies in Nigeria are born prematurely, and of course the doctors have told us that if a baby is born before 37 weeks, it means that that baby is premature. And I'm sure you have brothers whose wives or your sisters, your cousins who are either pregnant now or who is giving birth to maybe a premature baby. Do call in, ask your questions. You could get answers to different things. Okay, and if you're just a new mother, okay, you just gave birth to your child, or someone you want to ask some questions to the doctors, do call in on 0706-048-5853 or 0915-570-8347. That is the numbers to call. Don't forget, we are live on YouTube at High Voltage Nigeria. Okay, search for the handle. Do join us, and I'm sure you will learn one or two things. Please continue, doctor.
All right. So when we talk about prevention, we have to take it from multiple dimensions. Now, it starts even before a woman gets pregnant.
Okay.
Now we call it pregnancy prevention.
Okay.
For instance, if a woman has been a known diabetic, hypertensive, any other chronic medical condition, it would be nice to make sure that you are taking good care of yourself.
What kind of care?
Like sugar control, blood pressure control, sticking to your specialist advices and appointment, knowing that those medical conditions could be exaggerated during pregnancy with all the hormonal secretions and stress and all of that. So you have to be sure that you're already in a very good clinical condition as much as you can.
Okay.
Again, it's also advisable that you take care of your nutrition, healthy, balanced diet, optimize your weight.
Healthy, balanced diet in this economy.
Reduce your weight.
How do you
if
achieve?
you're already obese? Remember, the pre-pregnancy weight has effects in the course of the pregnancy.
Weight?
Yeah. Whether it's under or it's over, it's a problem. Again, if there is a family history, it's also the time to go to hospital for maybe genetic counseling, and you be assessed, and you know the risks and all of that. These are the things to do. Then if a lifestyle, smoking, alcohol intake, substance abuse, or those illicit drugs, is also to adjust the lifestyle one is indulging in. Then again, stress start limiting stress. Now, when you are now pregnant, it's good you go and register in a good hospital. That brings us to quality health care. Why will you go? The reason is that, especially if you have the family history or if you had once delivered a baby before time, you will be evaluated and assessed and classify you accordingly and find out probably the causes of those previous preterm. For instance, if it's someone that had cervical insufficiency, it will be monitored and know whether it requires uh, attending to circulage or bed rest. Then, if it's due to progesterone hormonal imbalance, some will be given supplemental progesterone. Then the pregnancy will be monitored. We all know that anything can go wrong at any time.
Okay.
Screen for infections, like she said, infection at the cervix, urinary tract infection, systemic infection, they can predispose to preterm delivery. So these are the benefits of registry early. You'll be monitored, you'll be assessed, the baby's growth will also be assessed and valued. Then depending on the identifiable cause, you will now be guided appropriately. Now, you have support is also very important here. It's part of the prevention.
Okay. We'll just hang on a second so we could take this call. Yeah, hello. Your call has been placed on hold.
Okay,
Please
so
wait.
okay, that was a mistake. Okay, do call back. Okay, we'll have quite a lot of persons trying to call in now. Just do keep trying to call 0706 048 5853. And if you're trying to call and it's not connecting, just do keep trying again. 0915 570 8347. That is our number this morning. Please continue, doctor.
So we talk about support from everybody around.
Okay.
You may need to rest. You may be excused from carrying heavy objects. Some people, by just process of lifting heavy objects, it will be a trigger. So you need family support, extended family support, to understand when you're asked to have a bed rest, you should have a bed rest. So with identifying your risk early, modifying the things that ought to be modified, presenting early to the hospital, go for antenatal clinic. Some women don't go early. They go when the doctor is about to finish so that they won't waste time. So most of those educational talk, they don't get it, how to take care of themselves, how to rest, what we call red flags, when to know that you're having this, this may be what is about to happen, when to run to the hospital. So you have to be going and make sure you're monitored, evaluated, both you and your baby. Then at doctor's discretion, depending on the cause, because it may not happen immediately. Some can actually come and with bed rest and some tocolytics, the drugs they give to quieten the contractions, you may just be admitted. After a few days of hospitalization, you go home. Then again, there are also drugs that can be given. Perhaps it's progressed to help the maturity of the baby, and that will improve their survival. So in all, it's about individual support, hospital support, community support. So if we get all these things right, we can prevent some. While in some cases, even having done everything that you need to have done, it will still expel. Most time maybe that the baby had congenital or chromosomal abnormalities, because these are different causes of preterm delivery. So maybe it has condition that is not really compatible with life. So most of them, at the end of the day,
The body just wants to expel it.
Congenital anomalies and all of them, may come out alive and just spend few minutes or few seconds and die.
And okay.
So at times you can't really hurt them.
Oh, okay. Doc, since you have quite a lot of things you want to say.
no.
No. Okay. All right. She said quite a lot of things. Okay. All right. If you're just joining us this is High Voltage, coming to you exclusively on Volt 104.3 FM. Malaika is my name, and we are talking to a very amazing woman right here in the studio, Dr. Chinelo Obiora Izuka, a consultant pediatrician and neonatologist at the newborn unit of the University of Nigeria Teaching Hospital in Tuku, Ozala. And also we have with us in the studio Dr. Grace Ago, a consultant pediatrician and neonatologist at the newborn unit of University of Nigeria in Nsukka. And we are talking about the World Premature Day and all of the things concerning prematurity. You can join us right here in the studio by calling in on 0706 048 5853 570-8347. When you call me, please turn down the volume on your radio so that we can talk. Now, are there myths? Right, let's talk about myths now. Are there myths surrounding mothers or mothers who gave birth to premature babies? Are there myths surrounding that?
Okay. The common ones I hear, the common one is that babies born below 7 months will survive better than babies born after 8 months.
Okay.
That's
babies,
one of the myths.
That's one of the myths. Babies born at 7 months?
At 7 months
will survive better
than the ones. And when I ask the mothers, why do you people feel this way? They say that they were told that at 8 months, the babies will turn back into blood. And,
tell me.
Yeah, so it's a myth.
Okay.
The older the baby is in the womb,
the stronger,
the more matured, and the likelihood of survival for the baby. That's one of the myths. And the common one that I've been hearing, I don't know about any other myth, but this is the one that stands out, and it's important that I mention it.
Okay, are there myths that you know?
Basically, that's one. And some people believing that the preterm birth, that a woman is that she cannot carry baby, no matter what you do, that she's been designated or designed not to carry the baby up to term. I don't know their reasons, but I know that most time when those factors are controlled, especially if they're modifiable ones, that they still pass that to their mates and still carry babies to term.
Okay, so are there anything that you're doing, as doctors to quell these myths in the minds of women when they come to the hospital? Are there like teachings? Are there an outreach? Are there some things that you do to teach these women that these things are not correct?
Yes, we have a lot of campaigns, educational talks. In fact, during antenatal visit, before the clinic starts properly, the health workers, they go there and discuss everything surrounding pregnancy, the labor, the beliefs, the needs, and the expectations. But the problem, like I said, that most of our women don't like coming early. They feel that when they come that too early, they spend time and they go almost at the same time with those that presented late. But all these things are being discussed because they need to be well educated and guided. Okay, so it's done.
Okay,
please. There's another thing I wanted to say. Apart from the fact that we educate them generally, once a woman comes to you and you find out that he believes in this, because when you educate a woman, you're educating a nation.
Okay.
So we try as much as possible to explain to them with reasons why it happens and clear their mind about the myths that they have, so that when they get home, they also talk about the same thing that they believe, and in that way people are knowing the truth more. So we educate them, the individual also.
Okay, so just a few more questions, right? Are there basic drugs that we take every day that could affect pregnancy? Are there drugs? I remember quite early in my marriage, before I started giving birth to children, right, I'd have maybe an ache, right, just maybe before my periods, okay, and I'm taking Panadol extra, okay, and okay, do we have a call? Hello.
Hello, good morning.
Good morning. Please, can you switch off your radio?
Okay, good
Okay, yes.
morning.
Good morning. Please ask your question.
Okay, my question is that I'm pregnant and I'm 5 months now. I'm
Yeah.
calling from Uganda. My name is Ugo.
Okay.
And my legs is swelling up.
Okay.
So I want to know the reason.
Okay. You're five
And another
months.
question,
Okay.
yeah, another question is that I went to scan when I was about 3 months. And they can say that I have a high placenta something or that.
Okay.
But when I came back, the doctor said that it means nothing. So I want to know if that thing is a serious case or
Okay.
something.
Okay. Thank you
Yeah.
very much. They'll answer your question. Doc, please, you care to
But
answer that question?
Okay. Thank you very much, madam. And let me start with the placenta that she mentioned.
Okay.
There are problems that can occur in the placenta. I don't know exactly what and the problem they told her because she said she had a high placenta something. So I'm just
This
going
is
to
something.
assume of the placenta problems that we have. One of them is the placenta can be low lying.
Okay.
By right, the placenta is supposed to be situated at the funda area of the uterus. In that way, it will not obstruct the baby when the baby is coming out. But when the placenta is low lying, being situated very close to the cervical area, there are tendencies that the the placenta can remove from attachment.
Okay.
It can bleed. It can also cause preterm delivery.
Wow.
And also the baby can actually die in the womb. So it depends. Apart from placenta being low lying, the placenta can also, we can have placenta abruption where placenta can start detaching from the uterus before time.
Okay.
So whatever placenta problem, I don't know what she has.
She has to check
She
it out.
has to check it out with the doctor. Then she said her leg is swelling
At 5 months.
at 5 months. Swelling of the leg close to delivery may be common because of the way the baby's head can be pressing on some vein that causes blood return,
Okay.
which makes the blood to be dampened on the leg.
Okay.
But when the leg is swelling early, there are other causes, there are other medical causes that may be involved.
Okay, so at 5 months, is her leg swelling early? That's the question now.
It's possible that it's swelling early.
At 5
So let me
months.
not just say and conclude that it's possible. Like when we're talking about preeclampsia, it may be a reason why a leg can swell early. It's important that she check out her urine. It's also important that she check out her blood pressure.
Okay.
It's important that she see a doctor so that they will make sure that that leg swelling early is just there. There is no other medical condition that is related to it.
Okay. All right. Okay. Thank you very much. You can join this conversation at 07060485853. It is 5 minutes before the hour of 9, and of course, we are just about rounding up. Okay. So, my dear doctor, any last words on prematurity?
Thank you very much. I want to thank you for the privilege to be here, and also want to thank our audience because I know people everywhere is listening to us. I want to emphasize on the need or the reason why we are here, because we are celebrating our giants. Being a preterm baby is not usually an easy journey. You can imagine starting your life quite early, fighting, struggling. So it's one of the reasons why we are doing this awareness, to celebrate them because of their strength and their resilience, and also to celebrate their parents. You can imagine having a child from day one, you are in a newborn unit. Some stays up to 30 days, 50 days, depending. Emotional draining, financial draining. And at the end, they were able to go home with their babies. So we also celebrate them. They are also our heroes. So we are using this moment to call on everybody to know that prematurity is with us. We have up to 3 million in Nigeria, and is a global health challenge.
good morning, Mr.
Okay, so good morning. 1 second. Yes, please just ask your question quickly.
No, actually, I want. I got pregnant when I was 18.
Okay, you're pregnant. Got pregnant when you were 18. Yes, go ahead.
Yeah. So, my family resisted that I should carry the child I shouldn't abort it.
Mm.
But I had a miscarriage
Okay.
actually.
Okay.
So I gave birth to the child before 9 months.
Okay.
But I used operation because the doctor said that
Okay.
my body hasn't developed very well, so I had to use CS.
Okay.
So,
Okay. So what's the
but
problem
now,
now? Hello. Okay. So we didn't get the question, but
Okay.
got pregnant at 18 and had
Cesarean C-section was this because of the same thing we talked
we talked
about.
about.
High
Okay.
risk pregnancy,
Okay.
not having and may not the baby may not come out easily and
Okay.
end up having problem or even die.
Yeah.
So the best option is to
To do a
section. So
C-section.
like I was saying, so we're encouraging everybody. It's a global advocacy. These babies will live if we will help them. The parents also need to be supported. So we are calling on everybody in any way you can help. You can visit us in our units. You can support us in any way you can. We have a lot of babies there that are even abandoned, that don't even have anybody to take care of them. And the most time we don't blame the parents because it's usually financially draining. So I thank you all of us, and I want to encourage us that even if you have a preterm delivery and you do what you're supposed to do, and with God on our side and all the support, that these babies can live and develop and reach their potential. So we want to thank everybody this morning.
Okay. Any last words, my dear doctor? 30 seconds.
Okay. Also to join my colleague, I want to thank all of us for having us and for listening. Prematurity is here with us, and the problems of premature babies are to the babies, to the mothers, and to the doctors as well that take care of them. And we're praying that we will be more aware and lend a hand in any way you can to the parents also. There are so many ways you can help the parents. There are so many support, financial, emotional, and otherwise that you can give to the parents. Thank you very much.
Thank you. Okay, thank you everyone who's joined us on today's edition. Thank you for joining us. Thank you for the ones that called in. We'll be back again here tomorrow. And this is High Voltage coming to you exclusively on Volt 104.3 FM. My name is Malaika. Have a good day. Hello, Enugu, and welcome to Volt 104.3 FM. Your music